start my video. Shall I?
Yeah. No.
Maybe next time onwards they should do this back drop. Apollo Tanagila.
Yeah. So shall we start?
I'm ready, ma'am.
Yeah. Okay.
So,
good afternoon and a very warm welcome to all of you who have logged into this webinar, especially from the other branches across. And this is going to be a very important session on cancer awareness. Actually, this is organized on behalf of our Employee Engagement Initiative as part of our wellness program. And we know, I'm sure all of you have understood the agonizing wait that a person has to undergo after he meets a doctor until the biopsy results come in. The very word biopsy, instills fear in most of us. There is no denying that cancer is on the rise, especially in India. And the statistics shows that there is a high risk of lung cancer among men and more of cervical and uterine cancer among women. This webinar is actually organized to commemorate World Cancer Day, which falls on February 4th. Most of us are familiar with the Cancerous Day that occurs in September, but that was more to appreciate and commemorate people who have survived and fought against cancer and who have come out through grit and determination. So the flow will be like this. We have Dr. Meenakshi Sundaram, our Senior Medical Officer, who will introduce the speaker for today. And before I hand over the mic to Dr. Meenakshi Sundaram, I would request the other participants who have logged in to put the mobiles on mute so that there's not much of disturbance, during the relay. And we would also have a question answer session. The speaker has made it clear that he would like to have the session to be a little interactive. So please post in your queries and questions in the Q&A box, and we can raise it up as and when it occurs. So thank you. And I hand it over now to Dr. Meenakshi Sundaram.
Thank you, Madam. Good afternoon. Welcome to this webinar on cancer awareness. I'm really very happy to join with you all in welcoming our speaker, Dr. S. Ayyappan, well-known surgical oncologist in Chennai. Welcome, sir. He is having a wide experience in the field of surgical oncology for more than 25 years. He completed his MCH from the reputed Adyar Cancer Institute in the year 1996. He has rendered service to the institute for more than a decade. Now, he is the head of the department, Surgical Oncology, Apollo Hospitals. He has expertise in treating breast cancer, colorectal cancer, and gynecological cancer, as well as he is an expert in laparoscopic surgeries. He has received Best Doctor Award in the field of cancer from Tamil Nadu Medical University in the year 2013. Cancer is one of the most common deadly disease which can affect any organ as well as any age group. It's the right time we know more about cancer from our speaker. Handing over to Dr. Ayyappan. Please, sir.
Thank you for that very sweet introduction, Dr. Meenakshi Sundaram. And Malini, madam, thank you for the opportunity also. Right. As Dr. Malini said, I'm not going to keep this as a frank lecture. I'm not projecting any slides. I thought I'll just take you through what is cancer and signs and symptoms. And let us have an interactive session, because I delivering a lecture and you listening or not listening is not going to help. But a lot of us will have some doubts in my field. If you have any doubts, if I know the answer, I'll be very happy to clear that. As Malini madam informed, each family, now see, she mentioned that the rise is there in cancer. It's not so, because it was already existing. The population, the lifespan of the population has become more. What was the average lifespan those days? As 40 has now become 60 and 70. So cancer is one thing which usually strikes the elderly age group. So we have lot of those patients coming now, and all of us, we are on our prime time, and we have our parents who are of that age group. So we tend to see a lot now. So existence is always there, but the awareness, the investigation modalities, and the communication, patient is able to come from the periphery to the center for treatment. All these things were not happening about 20, 30 years back. Patients, they will be there in their villages. If they get a disease, they'll relate it to some other problem and they die. Nowadays, patients are being brought to the hospitals, they're getting treated, and there are survivors who are going to tell us about these cancers also, who inform the others about the cancer, their good experiences or bad experiences, whatever happens, they try and inform. That is what is happening now, madam. Yes, there is a slight increase because of the environmental and because of the habits of individuals, lifetime modification, all those styles modification, everything matters a lot. I do accept with what you say. Yes, documentation of the cancers is also becoming more.
No.
All these things put together, we have some statistics as of today, which was not existing about 30, 40, 50 years. Now, let us start off with what we are intended to do today. Awareness of cancer. Madam also mentioned about World Cancer Day. The theme of this World Cancer Day, that is 2022, was closing the care gap. What we actually mean by that is, say, everybody is able to give some sort of a treatment. Everybody gets some sort of a treatment. But there is always a differentiation. What is the differentiation I'm talking about? Some of them get excellent treatment, state-of-the-art treatment. They get whatever is needed for that particular cancer. But some of them, they're not able to get any care. They get some hodgepodge care. They don't get the full care what is necessary for that particular type of cancer. This gap is quite heavy. It all depends on maybe the patient's education system or the awareness. Or these are which the WHO wants to concentrate. They want to close this care gap which is existing in the public. That is the theme. And this theme is for about, it is going to go for 3 years. That is for this year, 22, 23, and 24. They kept it for 3 years because any program, they cannot finish it within 1 year. They want it for 3 years, and 3 years, they have split it into various aspects. That is, again, they're trying to unite all of us, even the public, not only the doctors, even the public. For example, the public can also get involved. They can bring in some patient who is not able to come to the hospital. They need to try and bring the patient to the hospital. That is also one way of handling, one way of helping the patient. So the next year, what they have thought is unity. This year, we need to find out what are the gaps which are there in the cancer care. We need to try and establish, we need to understand what is a gap. Next year, the thing is, we need to try and unite. All of us need to try and unite. Then next year, that is in 2024, we need to take it to the people, that is the higher commands, the authorities, and make them aware that this is the problem and we need to find a solution for that. That is the whole thing about this World Cancer Day. That's the theme, is close the care gap. Now, what is that we are talking about? Cancer. Cancer, what is cancer? See, all of us, we think every lump, what we see in the body. See, a lot of us, we see some swellings in the hand, something in the neck, something in the leg, any part of the body. Superficially, you'll be able to palpate some swelling. Immediately, deep inside that thought, they'll think that it is a cancer thing. Any growth need not be defined as cancer. The word called as tumor can be used for that, but the tumor is defined as a benign fellow and a malignant fellow. Malignancy is what we call it as a cancer. A benign condition is that fellow which will not spread to any other site. It will be confined to that area. For example, if there is a swelling in this region, that might be confined only to that area. It will not spread to any other part of the body. That we call this a benign condition. A cancerous condition in the other way, it will start growing in that area and it has the tendency to spread to some other side. Coming back to the basic of what is cancer. A cancer is one thing wherein a cell, every time if you take a cell, the cell needs to replicate in a very orderly fashion. The best mechanism in the whole world is this thing, the replication of a cell, and it stops at one point where it needs to stop. But in cancer, what happens is there will be uncontrolled replication of cells, and that will be an unanimous thing. That will be autonomous. That will not be connected with the body at all. It will take care of itself. Autonomous, it will keep growing. It will not come into the control of the body. For example, if you have a small injury in your hand, we would not have noticed it so far. Now, if I'm going to tell you something, you will understand what I'm trying to say. If there is an injury, one cut injury, what happens? Exactly, the whole skin will grow back again and it will stop. Has anyone of you imagined why is it stopping like that? It's an excellent mechanism. It can always keep growing, but it stops exactly at the area where it's supposed to stop. It fills in the skin, it fills in the soft tissue, and then it stops. It does not grow beyond that point of time. But in cancer, what happens? There might be a growth or an ulcer or a breach that will keep on increasing in its size. That particular thing becomes autonomous. It does not come into the control. It is unique on its own. It has no control at all. That we call it as a cancer. So that is because whenever there is a growth in one area, whenever there is a cancer in a primary area, that we call it as a cancer, and we call it as a primary growth. If there is going to be a spread from that particular area to other organs or other sites, we call that area to where the growth has gone, we call that as a secondary cancer. So one is a primary cancer from where it is originated. So any part of the body can have cancer, except for the hair and for a nail. Nail bed can also have cancer. The nail does not have any cancer, or the hair does not give out any cancer. Other than that, all the other tissues are prone for getting into cancerous growth. So when this cancer is going to be in any organ, for example, whether it is going to be in the throat or in the lungs or in the say in the skin or in the oral cavity, in the stomach, in the esophagus, food pipe, wherever, in the breast or in the cervix, uterus, they are all called as a primary cancer. From there, they can spread on to other areas, which we call as a metastasis. So it can go to the lung or it can go to the liver. We call that as a secondary disease, that the disease has spread to another area. So we call that as an advanced disease. So now I've brought in a new term called as an advanced cancer and an early cancer. When do we call it as early cancer? If the cancer is confined to the organ of origin, we usually call it as an early cancer. That too, when it is a small disease, we call it as an early cancer. If the cancer is spread to another area from the primary origin, so we call it as an advanced cancer. This I'm putting it in simple terms. If it is confined and if it is small in an origin area, that is, for example, if it is in a breast, if it's confined only to the breast, it's a small cancer, we call it as an early breast cancer. If the cancer has spread to other organ and you have a cancer in the breast, from there it has spread to the bone, or if it is spread to the lungs or it's spread to the liver, we call it as a advanced cancer. And we have 4 stages in cancer: stage 1, 2, 3, and 4. We call early cancers as stage 1 or stage 2. Very early is stage 1. Advanced cancer is stage 4. Locally advanced cancer is stage 3. That is how we usually term it. So if there is a spread of disease to some other organ, as I told you, it is called as a stage 4 advanced metastatic cancer. So many a time patients come to us with something called as a grade of the disease and stage of the disease. There's a difference between stage and grade. Whatever I told you now, I told you early stage, advanced stage. Early stage is confined to that organ, advanced stage is spread to other organs. Now, I used another one terminology called as a grade. What is a grade? Grade is the disease after a biopsy. Once a tissue is taken from the primary tumor, we get what the type of cancer is, and we find out what is the aggressiveness of the cancer. So we have various grades. It's starting from grade 1, 2, and 3. So see, for example, if 10 of us are there, 10 human beings are there, each one will show some aggression towards one particular incident or one episode. So that one fellow may be very sober. He will not be bothered about anything. The other fellow will be very aggressive. He'll want to prove a lot of things. So likewise in cancer also it happens. Some of the cancers are very low grade. They are not aggressive. They don't spread very aggressively. They go very slowly. They grow very slowly in this organ wherever it is. But some cancers are very aggressive. They might be a small cancerous lump, but they will tend to spread to other organs. So they are called as a aggressive cancer or grade 3 high grade cancer. So this you need to be clear. Stage and grade, they are two different things. Why am I bringing this to you? Because many of the patient attenders who bring a biopsy report, they will always ask, "Yo, doctor, it is grade 3, grade 4, so stage is advanced stage." That's how they will talk. We need to understand grade is different, stage is different. Now, Dr. Meenakshi, should I stop here for taking some questions? I am okay with whatever you people want me to do. Because the lecture should be, or the talk should be useful for people so that I address them then and there. The doubts can be cleared. Even if you are doing some small discussion, it should be useful for somebody.
Definitely.
Even if
sir.
one person is going to be benefited, I'm happy about it.
Any questions?
If there are no questions, it means I'm explaining it very well, or
Yes.
nobody is interested. One of the two. Right. Now we'll go to the next part of the whole thing. So now, having known what cancer is. Yes, madam?
No, I think somebody has put in a question, sir. Are tumors, later, can they be converted to a cancer? This is from Mr. Prasad.
Prasad, it's a fantastic question. It's which is usually asked in an OP clinic. So cancer is one thing. Tumor, as I told you, any swelling in the body can be called as a tumor. So your question has 2-3 components. Doctor, you're mentioning benign. Can benign condition become cancerous thing?
Cancerous.
Ordinary swellings are there. Can they become cancerous? Should I treat every swelling in the body and should it come out of the body? Because at some point of time, it can become cancer. So the actual thing is, there are certain clinical situations which never becomes cancer. And there is always an exception to anything in life. There is always an exception. Less than 0.5% of all benign conditions, they can, sometimes I can call any breast swelling as a fibroadenoma. If there's a small component in that fibroadenoma, which can trigger of some changes in the long run, very, very long run, they can become a cancerous thing. Generally, how do we assess that? We take some needle biopsies, find out that they are just fibroadenoma. They don't have any other changes in it. And such cases, we keep them under observation. A very common swelling, which you usually see in the hand, in the body, is a lipoma, a cholesterol. That is the word which we doctors generally use it to the layman so that they will be able to understand. A fatty swelling, a fatty accumulation. We call that as the lipoma. Clinically, we'll be able to make out that that fellow is a normal, ordinary tumor. Very, 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 very rarely, these fellows can become into cancer. That we call as a sarcoma. But it does not happen overnight. Over a period of years, you'll be able to see the changes. That change is what we should not ignore. We should not ignore. For example, if there is a swelling which is here, for 10 years, it is of the same size. But suddenly, it is becoming bigger in size. Suddenly, it becomes painful. And suddenly, there is an ulcer over there. All those things, immediately you should recognize it, and then you need to go to your doctor. They are the signs wherein the normal swelling, which we are talking about, a lipoma, a fat globule, fat swelling, is suddenly changing because of some genetic changes which are happening in that swelling, in that particular cell, that can become into that of a cancer. So our advice is always, if you find out something which is abnormal in your body, keep your doctor, whomsoever your family consultant, or if you want to consult a specialist, just get an appointment, get it clarified from them of what it is, point number one. What are the precautions you are supposed to take for that? And what are the changes you need to look into it to be more careful that it is not changing into anything else which is abnormal. This is the carry-home message for the question which Prasad asked me.
Okay. There are 3 more questions, sir. Yes. Do we address it now?
I'm ready to take it. Yeah.
This is from Ms. Chitradeepa Anantaraman. Her question is grading or stage indication. Is it for doctors to determine the treatment or for patients to understand his or her conditions?
Yeah. See, what is happening in evolution is days when doctors used to take the diagnosis, take the decision of treatment, take everything on them, and then they used to do the treatment, and then, oh, you have a problem, or we will take care of it, and then that used to be the discussion. But now, today, that is not the scenario. Everything, each and every word of it, the attenders and the patient want to know, and they want to take part in the discussion of the treatment modality. Say, I have the right as of today only to give you the platter of treatment, whatever is available. It is not disowning the treatment modality or disowning the patient. It is nowadays is the vast difference for what I started practice in 96 and now today, a huge portion of a difference, because those days we used to decide the treatment for the patient. But nowadays, patient wants to take part in the decision making. So I tell them this is available, but this has its advantage, disadvantage, this has its advantage. Patient takes a decision. How can a patient take a decision? They need to be aware of certain things, and they need to know why the doctor is taking such a decision. So for example, initial days, there was only one modality of treatment, surgery. And till today, a lot of patients think if anything is there, cut and throw it off. The whole thing is done. They feel today you're coming to the clinic, I've shown you the swelling, cut and take it off, doctor. Let it be removed from my body. So for such patients, I need to keep them informed what is the reason I'm not cutting the tumor, but I'm subjecting the patient for some other modality of treatment, take the patient through that modality, and then take them up for surgery. For this, patient should have an idea of what the aggression of the tumor and what the stage of the disease. For example, if it's a very early disease, a single modality, for example, it might be a chemotherapy or it might be a surgery, that should be sufficient. But if the patient has an advanced disease, that is the advanced stage, for such patient, multimodal treatment is necessary. Chemotherapy may be necessary, surgery may be necessary, radiation therapy may be necessary. But the patient will immediately ask, doctor, for that patient, they also had this cancer, but only one treatment was given. Why? The stage would have been a very early stage. So only one treatment. So if the stage is advanced, patient needs multimodal treatment. That patient needs to understand. For that, the patient needs to know what I mean by a stage, what I mean by a grade. At least a basic the patient should have. Have I answered your question, Chitra?
Yes, she has two more queries, sir.
Go ahead.
Are cancerous tumors culture specific for Indians, South Indians, Japanese, Europeans, or are there any difference? And
Very
the other thing is,
question.
Yeah, which is the simplest blood test or cancer marker test that can be done to detect cancer earlier? So along with Chitra, even I had a doubt about the skin cancers. Is it specific for certain groups of people?
So shall I take one by one?
Yes, sir, please.
Yeah. Cancers, see, the question which Chitra has asked, each one particular group of people, they are exposed to certain risk factors and they are more prone for that particular type of cancer. For example, in India itself, in Andhra, we had some statistical evidence that they are more prone for stomach cancers, and that is because of the salt which is being used. If you use more of salt, what has been found out is that the cells, that particular thing, the layer of stomach, those cells go in for destruction. So once they are destructed, they are reproduced again. This keeps happening daily, hundreds of times in all our bodies. But to correct those things, if there is any mistake happening, to correct that, we have a lot of mechanisms in the body. Sometimes these things can go in a haphazard way. Something might be missed, the correction might be missed. So that becomes that of a cancer. This is more shown with patients who take a lot of salt. But we usually think it is the chili which is causing. It is not the chili what causes it, is the salt, because to mask the chili, we add salt. So if it is very spicy, what we do, let us add some more salt. So that is what is happening. Yes, in India itself, we have this stomach cancer differentiation is there. and Japanese are more prone for stomach cancers. And each of the cultural thing, if you have more of say red meat, say pork, and say all this beef and other things, they are not in Indian culture. They don't have. We don't take that as a staple diet. We don't take it daily. For us, rice is a staple diet. Wheat is a staple diet. That is what we usually breed on. But Europeans and other people, they go more for a red meat. The red meat, daily consumption of red meat in higher quantity, they are prone for colorectal cancers. So yes, whatever Chitra asks is correct. So by each ethnic, each type of a group of people for the risk what they are subjected to, and that organ is getting affected by that particular risk, and hence they are prone for more of that type of a cancer. The one what you asked, about that of the skin cancers. Skin cancers, yes, it is one thing which is more prone in people who are exposed to more of sunlight. So sunlight, what is the reason, doctor? You are telling sunlight everywhere. They are working in the farms in our country. So do you mean to say all of them will get skin cancers in our country? Yeah. In our country, it is basically the color of the skin also matters. We have something called as we have dark skin people. We have something called as a melanin pigment. That is the one which gives the color of the skin. So that is the protective mechanism. The melanin pigment itself is the protective mechanism. But in European countries, they go for sunbathing to the beaches. That is also riskier. That is why they have the sun protection factor, the ultraviolet rays which are there in the sun UV light. That causes some damages in the cells, in the DNA of the skin cells. So that can cause cancer. Yes, exposure to sunlight, more of sunlight can cause cancer. That is the answer for your question also.
Thank you.
Okay?
There are more queries coming in. I mean, do we take it on like that, or would you like to add on some more information and then
I'll add on some more information.
Yes,
and
sir.
Then I think we should take the questions.
Yes, sir.
Yeah? Okay.
Yeah. Thank you.
Let us move on to the signs and symptoms. What is a very important information I like to share with you when I talk about signs and symptoms are lot of the signs and symptoms what you will see pertaining or in combination with that of cancer is which can be seen in a normal condition also. In benign conditions also, you might have the same signs and symptoms. For example, if I'm going to say there is a ulcer in the tongue, ulcer in the mouth. A lot of people, they experience ulcers in the tongue and ulcer in the mouth. That is not, everything is not cancer. So if the same ulcer in the tongue or in the gums, in the cheek, if it is going to be persisting for a longer time, and if it is becoming big size, even after your attempt on treatment, then that needs to be given importance. Say tongue ulcer, which is not healing, the cheek, the gums, if they are not healing, that needs to be given importance. What you, Madam Malini Madam asked, if there is going to be a skin ulcer, which is not healing for a long period of time, that needs to be given importance. If there is a mole and the mole suddenly becomes bigger in size, if it becomes ulcerated, if it starts itching, and if it starts pouring some fluid, it starts cracking, the mole, the ordinary mole, immediately it needs to be brought to the notice of the doctor. Say suddenly you are having difficulty in swallowing, or periodically, that is for a period of time. First you will have difficulty in swallowing for solid foods, then it becomes difficulty for semi-solid, then you have difficulty for drinking water, you will have difficulty for swallowing your own saliva. All these things need to be brought to the notice because it's a progressive dysphagia, progressive in swallowing. Same way, if the patient is having difficulty in eating, because of that the patient starts vomiting, it's a sign of that of stomach cancer. It is not that all vomiting, all difficulty in swallowing are cancers. Persistent, and if it is not getting okay within a period or two, then it needs to be brought to the notice of your family physician, and then you need to be investigated. Likewise, if there is severe abdominal pain, the abdominal pain persists for a longer period of time, it is not getting relieved by any medication for a period of 1.5 to 2 weeks, it is persisting, it needs to be brought to the notice. Same way, if there is a bone pain which persists for a longer period of time, that needs to be brought to the notice. So if there is altered bowel habits, what do we mean by altered bowel habits? All of us are trained to have a certain type of a bowel habit. What do we mean by bowel habits? Whether you're passing defecation daily, that is passing motion daily. Some of us will have a habit of passing motion once in 2 days. That is also normal for that individual. So there should not be an alteration in that habit. Suddenly the fellow starts passing diarrhea, and it alters with that of the solid motion. Then it alters with that of a blood in motion. All these things you should be able to notice it, and if it stops and then if it recurs again, that needs investigation. Same way, you find it difficult to pass urination, you pass urine at least 4 times, 3 times in the night, you are not able to form a proper stream of urine, you are having difficulty in properly passing urination. If there is blood in urine, these things need to be brought to the notice. It can be also in urinary tract infection, but if it is persisting for some time, we are not people, you cannot take own decision. It needs to be brought to the notice, and that needs to be investigated. Suddenly some patients, for no reason, they will lose weight. For no reason, they lose weight. So such things need to be brought to the notice to find out whether they are having diabetes, tuberculosis, or whether they are suffering from some cancer. They may not be willing to, they might be wanting to eat, but they may not be able to eat properly. They will have loss of appetite can be there. This loss of appetite, why is it there is loss of appetite, doctor? It can be either because of a blockage somewhere, it might be because of vomiting, a feel of nausea, or they may not want to eat at all. They should have taken, but they will not eat. They will keep on losing weight. Why? Because some chemical substances are being produced by the cancer, which will block our system in the brain, where there's something called as a satiety center. It will go and block that area. So the fellow will not want to eat at all. So these things should be brought to the notice. Likewise, if the fellow is having unexplained fever, you can have fever for 3 days, 4 days, 5 days, 1 week is also okay. But you cannot have fever for a very long period of time. You should not have. If you are going to have fever for that sort of fever, it needs to be brought to the notice. Likewise, if you have lymph node swellings here, a lot of us can have lymph nodes. They may be an ordinary type of a lymph node, which might disappear after a month or so. Even if you have a sore throat, if you have some cough, cold, something like that, you develop some lymph nodes here in the neck. That should be brought to the notice if it is going to be persisting for a longer time. A very common thing, what happens is lump in the breast, swellings in the breast for ladies. So that the commonest thing is a fibroadenoma, which is a benign swelling, but it needs to be evaluated. Any lady above the age of 30, 35, they need to go for a breast examination. Either it should be an ultrasound of the breast, or it can be a mammogram, depending on the risk factor of the family of that particular lady. And the most important thing is awareness of one's own organ. Breast cancer is a very common cancer, and it's a easily examinable by the particular self itself. So we usually tell self breast examination is the most important thing each lady needs to know of. So the way to examine is by using your right hand palpate your left breast, because it's more convenient. You'll palpate with your left hand your left breast. So use the opposite hand, lie down, and then find out whether there is any abnormality in your breast. If you find any lumps or any abnormal which you are not aware of, you need to bring it to the notice of the treating physician, and you need to get examined. Likewise, if there is going to be bleeding from any of the orifices in the body, say for example the nose, the mouth, your penis, or your vagina, or your rectal orifice, that's an anal orifice, anywhere there is abnormal bleeding, or if there is bleeding for a continuous period of time, then it needs to be brought to the notice of any physician whom you have some confidence on. So they'll be able to help you out and find out what you're suffering from. Likewise, very important, your voice change, hoarseness of voice. For a period of time, you will have hoarseness of voice, which shows that you have some problem in your throat. Likewise, a repeated cough. See, in this COVID period, we had patients who had lung cancers who had a masking of COVID on them. So they thought that it is COVID. So they've been having repeated cough, dry coughs have been there. Please note, not all dry coughs or cancerous thing. Dry cough can be there for a week or 10 days. Even COVID has been there only for a week or 10 days. But some patients, they might have it for a longer period of time, 2 months, 3 months. They cannot take it for granted that because the human brain, it always wants to think only the easier part of it. It is not ready to think about abnormal. So we'll always counsel ourselves saying that, I will never get it. It cannot happen to me. It can never attack me. All those things the patients will keep thinking. And ultimately, to land up with some problem. So patients should be aware of one. If any problem which is abnormal for them, which is persisting for a longer period, for example, if it is more than 2 weeks, you need to consult. Nothing wrong in consulting and getting a good report or nothing. I mean, it's a good report. In fact, if you are able to catch something which is a sign or a symptom,
Arvind?
I guess there's a network issue with the doctor.
Yes.
I guess he's back online.
Arvind, there's a problem with the sound, Arvind. The network. Sir, you're on mute.
I said,
Sir, no, Dr. Ayyappan. Srija, please ask Dr. Ayyappan to unmute. Yeah, okay.
Malini madam.
Yeah, thank you. Sorry.
I'll
Because-
extend by 1 minute. Don't worry.
No,
Till 4:1 we'll talk. Don't
Yeah.
no.
take 10 minutes.
No. Okay, so now these are all the signs and symptoms. So if anybody wants to add something or you want to ask something, I'm open for that.
Yes, sir. There are some more queries that have come up, sir.
Hmm.
As you were talking about self-breast examination, Ms. Vijayalakshmi has posted a question about when is it yearly? Is mammogram test to be done yearly once, or what is the duration to take a mammogram?
See, usually, let me answer that in a formatted way. So
Yes.
usually breast self-examination, that's the most important thing. Breast self-examination once a month. Okay. And when is it to be done? See, a preferable thing is after the ladies have their menstruation, because that is the time they will not have any much of pain. On some of them, they experience pre-menstrual pain on their breast. So they may not be able to examine the breast comfortably. So what we routinely suggest is post-menstruation, they'll be able to comfortably, because there'll be no pain, they'll be able to palpate the breast comfortably. So post-menstrual, every month after the menstruation is over, they can examine. That is a breast self-examination. Right? After the age of 35, it is advisable that they get their mammogram or an ultrasound depending on the texture of the breast. So preferably is a mammogram, which is a better investigation when compared to that of an ultrasound. And if there is a risk factor in the family, that is the first degree relatives, the mother, or say, for example, the grandmother, second degree, if the sisters, anybody has in their family, then depending on the risk factors, the duration every year or something, nothing wrong in that. And it depends on each individuals also and the institute where they are getting evaluated. But what are the guidelines? At least from 35 to 38 continuously for 3 years, then every once in a 3 years is also okay. If there's a risk factor, every year it needs to be done. So that is the way we go about for mammograms.
Okay. Thank you, sir. There's the other one about diet.
Yeah.
They have asked whether non-vegetarian diet needs to be avoided if one has to be treated for cancer. Is it a myth? This is from an anonymous attendee.
It need not be anonymous. You don't need to feel bad about asking this question, because say that is non-vegetarian food does not have anything to do with cancer, except that please understand one thing. Anything in large quantities for a frequently done is always dangerous. For example, when I started my discussion, I was mentioning about red meat. And when the second question, I think Madam Chitra asked about the cultural things of each groups. So in that also I mentioned red meat, the mammalian meat, that is meat which is a pork or a beef. These things we call them as a red meat. If these things are consumed daily, 2 or 3 times daily in higher quantities, they cause certain things on the colon. Why is it happen? Red meat are generally supposed to have more of a cholesterol and fat and estriol and all those things are there in that of red meat. So this can cause injuries to the colon and they produce some sort of cancer. So anything in large quantities, any chemicals for that matter. So asbestos, they are all known things. How does it happen? It is not one day exposure. It is over a period of time. See, these are all patients who are occupational hazards, asbestosis and vinyl chloride. These are benzene. These have all been proved if they are exposed for a long duration of time, they can go in for that of cancer. So when the patient is on treatment, can the patient consume non-vegetarian food?
Non-vegetarian.
Patient can consume any type of food if it is done in a very clean, healthy manner, if it is prepared properly. So generally, what we inform patient and their attenders is, when the patient is on chemotherapy, generally what happens is that immunity slightly drops in for some patients, not for all patients. So such time, that will be usually from the 9th to 14th day, the act on the bone marrows and a slight dip can be there. We request the patients and attenders to be careful on those days. The cooking, everything should be proper. They should not be given anything which is infected or anything which is not healthier for them. That is the only time we tell them, be careful. Otherwise, the patient can take any type of food in small quantities, any type of treatment, during treatment.
Yeah. In continuation with diet, sir, there is another query that has been raised. I also noticed that more number of pure vegetarian senior citizens are prone to colorectal cancer in the past 5 years.
Yeah.
I have come across 6 or 7 instances among my friends' circle. So why is this, especially in the Tamil Brahmin community? I see it
already
rising.
answered the question.
Yes.
She has she has answered the question.
Herself.
She has answered. Yeah,
Okay.
she told on
Yeah.
beautiful word. Elderly people.
Okay.
Okay. So all elderly people, even me, you, whoever is the screen, first risk factor for cancer is age. Second risk factor, age. Age is the most important risk factor for cancer. When we grow older, what happens? Any organ is subjected for more wear and tear. So when there is an injury to the organ tries to replicate the cells and it repairs. So this process keeps on happening over a period of time. So when this repairing process is happening, when there is a damage, as I mentioned to you earlier, the body's mechanism is to immediately go on repair that damage, whatever has happened. But that repairing, damaging things are happening millions of times in each person's body, in each part of the body also. But sometimes, very rarely, sometimes unfortunate, the gene which is screening the whole defect, I'm talking about the genetic defect which happens in individuals. The genetic defect can be, say, it might be missed by the gene, that defect. So that defect over a period of time, that becomes into that of cancer. And that is more commonly seen with that of elderly people. That is why she has been, the only thing she needs to be seeing all those 6 people, are they related to each other? Whether they are blood-wise related to each other. If they are related to each other, we usually tell them it is a genetically oriented. For example, the grandfather, father, the kid, and the family members, all of them are, we call them something called the Lynch Syndrome, and all those things are there. They are all genetically oriented. Those things need to be kept in mind.
Okay. So there are some more questions, but can we take a break so that you go a little into prevention and then we'll continue, sir?
Yeah, I'm okay.
Is that okay? Yeah. Thank you.
Right. Or what do you mean by break? Should I take
No. We want you to
question
talk
break.
so that, question
break. Yes.
Right. Now, say they wanted something to lifestyle modification. Something.
Yes.
Okay.
Yes.
So say lifestyle, right? There are, what do we mean by lifestyle modification? That is important thing what you need to understand. In a person's life, there are two things what we do very often in a day-to-day activity. Very often, in the sense I'm now telling, it's the two things which are important is a physical activity and your eating habits. These are things which routinely all of us will have some sort of a habit. So what do you mean by lifestyle? This one is a lifestyle. For example, I keep eating at this point of time. I just come back to work. I just keep doing work and then keep doing something. That is one sort of a lifestyle. That becomes a habit over a period of number of years. But I need to alter that. That I need to modify. My eating habits, my physical activity habits. These are two things which very commonly happening. Those habits I'm telling, that needs to be modified. And that modification should persist for about months and years. Then only you'll get any benefit. So I'm not eating healthily and I eat healthily for a week's time. And then I stop eating and I go back to my original habit. That is not modification. Whatever I modified should go on for years to get the benefit out of the modification. That all of you should understand very clearly. If I am doing something bad eating habit, I should change the eating habit to a good habit and persist on that habit for years. If I am not doing exercises, I need to do exercises daily, and the benefit of the exercises will be given to you only after some years. It does not happen overnight. Please understand. That is what we call as lifestyle modifications. So where all can we do our lifestyle modifications? There are certain things. So very important is healthy eating habits. Reduce your rice, reduce your sweets, increase your vegetables, increase your fruits. So it is very, it is a thing which we tell about eating habits. Next is your physical activity. Good physical activity. Whatever, when you are walking, try to walk a bit faster. Lot of people say, doc, from morning to night, I'm working, doctor. Okay, working. That has become your habit. And that is your work. You are not doing anything extra. That has become your daily routine, day-to-day affair. But you need to add something to that. You need to do your physical exercises. That is a must. That is one more modification, because exercises and other things will help you to improve your immune system. It improves a lot of other things. It reduces your weight, brings your body into a proper weight, a healthy weight, which is very important in the long run. So that exercise, that should be done. That is a change in your modification, lifestyle modification. So keep your body in proper weight check. For your height, there should be a proper weight. You cannot have an obesity. So you need to modify that thing also. These are all things which falls into your lifestyle modification. As I told you, the weight, to keep yourself, check to yourself on a proper weight, and you need to have a proper dietic habits. You need to do proper exercise. A very important thing, two things are very important. Avoid tobacco in any form. In any form. You can stylely, you can smoke. You can have a pipe. You can have a BD. You can do snuff, nasal snuff. You can go for under the tongue, you can keep tobacco. Lot of varieties of way you can use tobacco. Avoid tobacco in any form. That is what is important. And one more thing, people who take alcohol, I am not against them. We usually call them in a quantifiable way you take it. So, doc, I take one peg, doctor, daily. Is that okay? A lot of them will ask us. So if I give them one peg allowance, it will go, the peg will become bigger peg. So that is what we mean by be careful with your quantifying. It should be a healthy thing. That is very important. Likewise, your sexual practice should also be proper. Safe sex should be there. Why are you bothered with sex, doctor? Why are you talking about that? Because certain viruses are transmitted by sexual habits. That is like very commonly is a human papilloma virus, hepatitis B virus, the hepatitis C virus. All these things, they go by the sexual habits. So what happens in sexual habits? Common cancers can be there. Cervical cancer, the commonest thing is human papilloma virus. You can have liver cancers. Hepatocellular carcinomas can be because of hepatitis B or hepatitis C. All these things are also very important. Safe sexual habits. Likewise, it is important that, see, many of my patients, when they come to the clinic, doctor, I am 65, till date, I have never entered into the hospital. That is wrong. Your thought process or feeling proud that I have never entered a hospital is wrong. It is better that you go for a proper screening and screen yourself to check whether you are suffering from any cancerous diseases, so that if at all you are suffering from any cancerous diseases, the thing will be caught up in an earlier stage and it can be treated more comfortably. So it is the individual's very important thing that the individual, this is also a lifestyle modification. I'll not enter the hospital. If I go into the hospital, the doctor will tell something. He will give that investigation. Unnecessarily, I need to spend money. These are all the arguments we usually listen. But what happens? They don't go for the screening. They don't go for any investigation. They get caught into major trouble. And at the end of the whole show, they'll spend a lot of money for that. They could have spent 10,000 rupees, screen themselves, and they can be comfortable. If at all they find out at the end of some 4-5 screening sessions, they find out a small lesion, it can be treated, and then the patient can be cured also. The amount of money spent will be less. The amount of hospitalization will be less. The morbidity which the patient faces because of the treatment will be less. Less amount of days spent in the hospital. You will be able to return back to your work very early. These are all the advantages of screening and catching the disease in an earlier stage. Patient will be able to go back to their offices very early. The amount spent will be less. The morbidity will be less. The trauma, emotional trauma which the patient goes through, or the patient's home friend which goes through, it all be very less. So this way you can modify your lifestyles. Very, very important. Again, I'm telling you, you modify whatever you do into a good practice and you persist and practice it for some time, at least for some years, then only you'll reap the benefit of it. You do it for 1 month and say, oh, I'm not having a benefit. Now you will never lose weight. You lose it only over a period of time. So those things are very important when you're talking about lifestyle modifications. And what Madam was, Malini Madam was asking about screening.
Yes.
When do you screen? When you don't have any symptoms, when you don't have any signs, you're a normal individual. When the normal individual goes and checks themselves, that we call it a screening. When a person has some symptoms or signs, then you go for investigation. That we don't call it a screening at all. A non-symptomatic individual going and getting themselves tested for a targeted thing. For example, a normal lady, she goes in for a mammogram. She does not find anything, but she wants to find out whether any early stage disease is there. So she goes to the clinic, gets herself a screening mammogram. That we call a screening. Not after getting pain or having a lump and then going for it. That is not called a screening at all. So that is the difference between a screening and an investigation when you have a symptom. So I told you the advantages of getting screened. I've told you about lifestyle modifications also. And it is very important. What the take-home message, what everybody should know is, if your family member, somebody has a cancer, the important thing is, please request them to go for a continuous follow at least once a year. The reason for why I'm telling you that is, once you get treated, some of the patients, they feel everything is done. They don't go for reviews and checkups. What happens is, if there is going to be a recurrent disease in the same spot or in a different area, they tend to miss out on the recurrences. If the recurrences are caught earlier, we'll be able to help the patient. We'll be able to get the patient out of the danger, and we'll be able to save the patient.
So there are some more questions. You'll be able to take them, sir. Just 5 more.
Yeah, I'll take them.
You want to leave? Yeah. Thank you, sir.
I'll take some questions.
Yeah. So this is about the marker. Chitradeepa has again raised a query asking whether there are any blood tests to pick up cancers at an early stage. Yeah. Any markers?
The markers is a different thing.
Okay.
And blood test to pick up early cancers is a different thing. If the patient is suffering from a cancer and the patient is being done some blood test to pick up that recurrence faster, that we call as a tumor marker.
Fine.
Tumor markers. For example, if the patient is suffering from a colonic malignancy, for such cases, if the patient is having a liver cancer, for such cases, we have some tumor markers, wherein those tumors, they secrete some amount of substances which can be identified in the blood of that particular person, and that can be picked up if the patient is having a recurrence. They are all known cases of
Okay.
colonic malignancy, known case of hepatocellular carcinomas. In such cases, we have something called the tumor markers, where you'll be able to pick it up. So that is one thing, and that is the reason I told the patient should be on regular, continuous, proper follow-up. Such cases, we have something called the tumor markers. Her first thing, her straightforward question: I'm a normal fellow. I'm running around normally. I go and give one blood sample. Will you be able to find out whether I have cancer? Clinically, in clinical practice, we don't have something like that. But all of us want some investigation to come up, wherein if their blood is given, you will be able to tell whether there is cancer in any part of the body. Yes, it is coming up as of now. It is not into clinical practice as of today. What we have is only tumor markers to pick up if the patient is a known cancer patient. On that case, to identify whether the fellow has a recurrence, we have certain markers to be done. And that can also be used as a screening method also. For example, if the person crosses the age of 70 or 60, a male patient. So for such cases, we generally, when the patient comes in for screening, we ask for something called a prostate specific antigen to find out whether the patient is suffering from a prostatic cancer. Patient may not have any symptoms, but the patient might have a very early disease. So it has been proved to be a very important thing. So generally, otherwise, markers are used only as a complementary investigation rather than a diagnostic investigation.
Okay. Thank you, sir. That has been clear. There is one query raised by Mr. Ranganathan. His query is, can we integrate other branches of treatment like Ayurveda and other medicines along with the treatment modalities to control this illness?
Okay, right. Ranganathan sir, honestly speaking, I know nothing about Ayurveda or Siddha. So I'm not an expert to answer that question. But what I would prefer if I'm treating a patient is, please get this very clear. I'm not against Ayurveda or Siddha. I know nothing about Ayurveda or Siddha, so I cannot comment on that. But when a patient comes to me for treatment, what I generally suggest is complete whatever the treatment I have to offer you. After that, in the follow-up, if you want, you can add on to whatever the other modalities of treatment is available. The patients are, why doctor? I don't know whether there is going to be a cross reaction or any side effect. I give one treatment, I know what are the side effects will be. If I face some rare side effect, I don't know it is because of this drug or because of the add-on treatment, whatever you're going to have. So my humble suggestion is, believe one form of treatment and go for that form of treatment. I know what I am doing, so I would prefer to answer to the questions of whatever, and I am ready to take up the responsibility of treating that patient with my modality of management.
Fine. So this is from Madurai. Ms. Ranganagi has asked, are we prone to stomach cancer in view of the excessive fertilizers and chemicals used in cultivation of vegetables and fruits? Now that we are not able to avoid using these vegetables and fruits, please suggest some do's and don'ts as a preventive method.
Maybe you should cultivate them in your house, use organic thing and all those, take all precautions. Yes.
Yeah.
See, anything exposed for a long period of time is prone for some diseases, madam. But stomach cancers generally don't go by these chemicals. We don't have statistics for that, but it's a general belief that all these chemicals, which if they are going to be used in large quantities and if you're going to consume without cleaning them and all those things, then you're prone for some health issues. So there is no straightforward do's and don'ts. Only thing is, I would say, be careful from wherever you purchase and try to say, many a time we cook off everything. Everything is boiled, everything. So they don't have much of side effects on that.
Yeah. So just two more, sir. One, Mr. Ganesh Srinivasan has asked, my mom has recently got breast cancer, lymph nodes, and got the biopsy and detected TB. Is it curable and treatment period? No, it's curable and treatment period. I think.
No. What has he got? He has mentioned of two things. One is
Yes.
a non-communicable disease, the other one is a communicable disease. Both he has mentioned. So
Yes.
we do see patients who are having both breast cancers and tuberculosis.
Tuberculosis.
So depending on the stage, breast cancer is curable. Generally, tuberculosis also curable. So we prefer to treat the cancer first and then put the patient on anti-tuberculosis treatment, which I'm very, very sure if the lymph nodes are positive, the medical oncologist is also involved in the whole case. So they will be able to time when they are supposed to give the chemotherapy and when they will be incorporating the anti-tuberculosis treatment. I am very sure his mother will become okay, and I hope she's being treated comfortably and properly at some place.
Okay. Sir, along with that, usual TB treatment is for around 6 months, isn't it? So will it be the same 6 months or will it have to be extended in
it will
this?
Be the same 6 months.
Okay.
Now, this thing, tuberculosis center, they are having different protocols depending on the types also. So the number of medications, all those things, each year, these things are getting advanced in the treatment because of various protocols are being followed. So definitely the medical oncologist will coordinate with the infectious disease specialist and they'll get the protocol which is necessary for his mom and she can be cured of the disease. That is what is important. That is the knowledge he needs to have.
Yeah, I think we have
Generally,
to.
what I answer on this thing, Malini, I tell them, if it's going to be about 6 months or if it's got 9 months, get it treated. So just because if it's going to be 9 months or we're going to not treat the patient, because the opportunity of getting cured is very high.
Okay.
So whether it is for 6 months or 9 months, get it treated. That is what is important there.
Yeah. Thank you, sir. I request our participants not to put up any more questions. We'll just finish with whatever is there in the question and answer thing, because I think sir will also have to carry on with his other work. Yeah. There's just 2 more, sir, which says that one is to thank you. That person is a survivor and she says, I hardly get time to meet Dr. Ayyappan at Apollo. Very happy to have answered all these questions. And the other thing is about from Archana. She asked, what sort of cancers are genetically predisposing to genetic transfer from one generation to the other? Is there any specific types of cancer that can be transmitted that way?
Archana, this is a very sensitive question.
Yeah.
In fact, what I want anybody to understand is not all cancers in all the families, they go to the next generation. Please get that very clear in your mind first before you understand whatever the answer I'm going to give to you. So please, I repeat again. For example, if a mother has cancer, it does not mean whatever the cancer that mother has, immediately all the kids will have. It does not work like that. Get that point very clearly into your mind. The question actually what you asked, yes, cancers are genetically prone because the whole basis of the disease is genetic oriented. We can talk about lifestyle modification, we can talk about the environment, we can talk about anything. But ultimately, where do they go and hit? They hit the genetics of each individual. And that is where in the DNA and the genes there, that's where the changes happens. That can make the patient go in for cancer disease. If that particular gene is transferred on to the offsprings, that particular gene can also be overtaken by other factors. That is where we request for lifestyle modifications. Your own immunity can take care of that thing. It can suppress that particular gene and it can save you from cancer. That's why we want a proper lifestyle for each individual. That is one issue. The thing is, the common cancer which you can see going by the genetics is your very well-known factors or your colorectal cancers, your breast cancers. These are common things, but there are also the fellows, the percentage, if you take, which goes in the generation is less than 0.5%. Please understand that. So what do I mean by that? If 100 patients, colon cancer patients are there, only less than one fellow might be having in this generation. Other 99, because there may be the first case in the whole family chain. Am I clear to you, Archana?
Yeah.
Because if you need to understand this very clearly, or else every human being will be scared that parent has, so I will get it now. Or I have, my child will get it. No, it doesn't work like that. It doesn't go like that. That is the message which I want to pass on to Archana.
Yeah. Thank you, sir. The last one is, about the effect of cell phone on cancer. That is by Vijay Raghavan, and Sashikala has also raised about sleeping habits and cancer.
Yeah,
So this will wind up.
sleeping habits is, it is always considered that the more they adequate, healthy sleeping habits makes your cells to get back the repair mechanism, which is definitely necessary for anything. Whether it's not only for cancer, for any problem, basic problem, you need repairing mechanisms to happen properly. For that, your sleeping habit, proper sleeping habit, at least of 6 to 7 hours a day, uninterrupted sleep is a necessity. That is point number 1 for you. That is the answer for the sleeping thing. Regarding the cell phone, studies, statistics are still happening, wherein there are controversial reports. It has nothing to do with your brain or any other cancers, neural cancers. Some reports say there can be a chance, but anything, we need to wait for a longer period of time to get the actual reports. We are still very small in the usage of your mobile phones to have their effects in the coming generation. We need to wait for those things. But when a doubt is there, healthy habits about your cell phone is the ideal thing.
Thank you. So that can be included in our lifestyle modification, I guess.
Exactly.
Okay. So I think we'll stop with this, and I request our Chief Medical Officer, Dr. Manju, to formally wind up the session. Unmute, ma'am. Ma'am. Yeah.
Sorry. Good evening, all. I just saw it was a wonderful talk from Dr. Ayyappan. On behalf of the Hindu group, I thank Dr. Ayyappan, Senior Surgical Oncologist, Apollo Hospitals, for his enlightening talk on early detection and prevention of cancer. The best, as doctor said, the best way to treat cancer is to prevent its occurrence and detect at the earliest stage. And all of us should be aware of the signs and earlier signs and symptoms, as Dr. Ayyappan highlighted. Thank you, sir. And I would like to thank the management of the Hindu group of publications, Ms. Rija of Apollo Hospitals, and all the participants. Thank you all. And
thank you again, sir.
I have one.
No, it's about our policy, insurance. Yes.
Yeah. Just wanted to make one small announcement. Since our group medical insurance is due for renewal in May 2022, I request all the employees to upload their family details in the link, which will be provided soon. And
Fantastic.
I suggest all employees to
use the forum for that also.
Exactly.
Excellent.
Yes, sir. Yeah. Yes, sir.
So I just suggest all employees to opt for top-up, especially those with comorbidities, diabetes, hypertension, to cover the unexpected medical emergencies and the higher medical costs.
Madam, this is very, very important. This we see in our day-to-day practice,
Yes.
Till it strikes, they will not know the importance. And one more thing, which I also started doing with my own health insurance, is sit and talk with the fellow who sells the insurance to you. Because when they enter into the hospital, this is not covered, that is not covered, you cannot go here, you cannot go there, all those things will be happening. They will ask us, we know nothing about it, we direct it to the insurance fellow, the insurance fellow will disappear. Please take care of that also. Since this topic came in front of me day to day, we face this thing from the patient. Some of them, they start crying in front of us, we don't know what to do. So this is one thing I've started telling. Just the insurance fellow, discuss with him what it actually covers.
Yes,
and then take a decision.
Yeah.
I'm
Thank
sorry
you,
if I had overdone that insurance question.
No.
I thought I should tell my view on the whole thing.
Please, sir, it matters a lot. So thank you, sir. Because already our company has a base amount, but to top it up, it's up to the individual. So that's what we want to stress on.
Please top it up. It will be very useful. We see it on day to day here. So it's very useful for a lot of patients.
Yeah, we value inputs, sir. So thank you once again. It was wonderful listening to you.
All the best.
I'm going to send the feedback, and I already know what it's going to be. Thank you.
Bye, madam.
Bye, sir.
Thank you.
Bye.
Thank
Bye.
you.
Thanks, Rija, for all the help and support.
Yeah, thank you, ma'am. Thank you. Thanks a lot.